Hello, everybody, and welcome to the Adult and Pediatric Institute podcast. My name is Nicole. I am your host. This is a podcast where we get messy, we get real, we talk about real life stuff, and we use limited filters. So, real quick before we jump into this episode that I'm super excited to do, and this amazing human being put on this planet to help struggling moms like myself. Before I jump into introducing her, I want to talk about my last podcast real quick, just briefly. The last podcast episode is where I kind of broke down some of RFK Jr.'s misinformation, we'll call it, on his press conference. I've gotten a lot of really good feedback on that. I love to hear from listeners. I love to know, what are you guys struggling with in real life? Because I want this podcast to be applicable to the struggles that you're going through and the struggles that you are seeing. And so that leads me into today's guest. So today I have the absolutely amazing Dr. Allison Mell. She is the founder of Tots On Target. She is a physical therapist. And if you are going through an autism journey like I am with my kids, if you don't know already, you will soon, how absolutely critical it is to have physical therapy in your daily routine with your child, and how that can greatly impact their future success in life. So, Dr. Allison, thank you for joining us on the podcast.
Thank you so much for having me. What a warm welcome. I am so appreciative of that introduction, and I am so excited to be here.
Oh, you are so welcome. So I'm really excited to get to kind of introduce you to some of our listeners and some of our followers, and get some of the amazing information out there about physical therapy. So why don't we start off with you, just tell us about your company and what you created.
Sure. Thank you so much. As you said, I'm a pediatric physical therapist. Since I came out of school, I always knew that I wanted to work with children, and that is where I have focused my entire attention in my career. When I started out, I worked in a sensory gym with kids everywhere from, I would say, 2, 3 years old through like 10, 11. And then I went on to work in the school system. I worked in a preschool kindergarten, and I saw a few older kids as well. Now I started Tots on Target, where I primarily focus on baby and toddler development. And so I've really run the whole gamut. I also put out a lot of content on my Instagram page. I'm also on TikTok and YouTube and all the channels, Tots on Target. I really feel like it's so important and empowering for parents to understand development and know what they can do at home as well, so that they can help their children. The most important thing about being a parent is that you have the information that you can either help your kids from home or at least advocate appropriately, because when you have the knowledge, that's when you can be the best advocate.
Absolutely. And I love that you brought up kind of your social media outlets, especially with your Instagram, because I think that that makes your knowledge and your wisdom and your guidance and advice on what parents can do at home, it makes it so accessible
Yeah.
to everybody.
Exactly. And it's really amazing because when I became a parent, Instagram wasn't a thing, which sounds like I'm so old. And I don't feel so old, but when I think about when I became a parent, I have twins who are now 14, and then I have 2 other children, and they didn't have this. And so it's really amazing that parents now, I mean everybody, but we're talking to the parent community, have all this information at their fingertips, which is both incredible and overwhelming, because
Very,
it
yeah.
can, right? It can feel like, wow, like I can really learn so much and I can explore and I can find out. But then also it's like, oh my gosh, there's so much information. What am I learning that's important for me? Is all this correct information? What's not correct information? What's too much for me to know? All that kind of stuff. And so it's the good and bad of everything.
Yeah, yeah, and I have a 12-year-old and an 8-year-old, and you start off looking up orthotic inserts
Yeah.
for your 12-year-old online, and next thing you know, I've gone down a rabbit hole, and I'm now looking at baby carriers again, and
Yeah.
it's like, "Whoa,
You're like,
how did
should I
this
get there?
happen?"
Totally.
Right. Yeah, so you're able to kind of help guide these parents and break down some of the information that is out there, and this is accurate, and this is maybe not applicable to your child, so I wouldn't waste my time on that. Is
Right.
that kind of correct?
Absolutely. Absolutely.
Yeah. So how did you get into this field? It sounds like you have just an absolute wealth of experience of
Yeah.
all different settings and population. What made you want to pick kids?
That's a great question. Ever since I was like a teenager myself, I was always a camp counselor and babysitting, and I was a lifeguard at camps. So I always had a lot of kid experience. And then when I was in college, I figured that I wanted to do physical therapy. That was what I was leaning towards. I even worked at a sleepaway camp for children with developmental delays. And when I say children, it actually went up to 21-year-olds, because in this world, that can legally be when you get services through. And
Yeah.
so I worked at a sleepaway camp for developmentally delayed children and young adults. And I just fell in love with the pediatric community all over again, but from the lens of the therapist. And so when I went into PT school, I wanted to do my clinicals I did one of them in a school. And right after I graduated, I started out in outpatient because I just got hired for maternity leave coverage. And I just felt like it was wrong. I was like, I know that I'm meant to work with children. And I got a job then in a sensory gym. And I loved it. I feel like when you're working with children, you are setting up their lives for the future. You are giving them the most independence they possibly can have. You are giving parents that extra support that they need, and you're really setting them up for the future. And that's really where my love and attention and focus needed to be. And I have been able to use that in, again, as I said, different settings, different age groups. And it's just given me, I really have dived. I dove into this and really have just never looked back. I really just love the pediatric setting.
Yeah, and I think that as a clinician, because by trade I'm a registered nurse, when you get out of school and a lot of the times during school, you're getting exposed to all these different populations and all these different age groups and throughout the lifespan, and you tend to gravitate towards one or the other. And it
Yeah.
sounds like you kind of had just that maternal instinct about you from a very young age that you
Yeah.
wanted to care for the upcoming generations.
100%. That's exactly spot on.
And I think what you said really resonated with me just now of you felt like you could really make a difference in someone's future. And I feel that same way working with kids.
Yeah.
This is something that, you know, they have the rest of their life to live and sky's the limit. And if you can help them when they're at their youngest and they're most vulnerable, you can make a lasting impact that carries on with them for potentially 80, 90 years.
Yes, 100%. When thinking about the autistic population, with children with autism, when I worked in a school setting and I saw the team come together to support each child, when I saw the teacher that was so effective and so caring, and then me as a PT, an OT, a speech therapist, when we worked as a team together to support each child, the amount of growth that we were able to see was really unbelievable. And when those stars aligned and we got a great team effort going, it changes the trajectory.
It really does. And you see more improvements and better outcomes in a shorter period of time.
100%.
Yeah,
Absolutely.
and I tell clients that all the time. Therapy is most effective, and this applies to autism, ADHD, any sort of neurodevelopmental disorder, as well as throughout the lifespan. Anything that you're, looking at, hospital recovery, hip replacement surgeries, when you have all of your therapies working together, when you have OT, speech, maybe ABA therapy, physical therapy, especially working together, and they're all working on the same goals, but they're taking a different approach depending on their scope, that's when we see huge improvements.
Yes.
Suddenly, your child who's a toe walker, within months, they've stopped walking on their toes and they're not complaining of hip and knee pain anymore,
Yeah.
or they're not sensitive in those areas because everyone's kind of working on it together through a different lens.
Exactly. Exactly. And really, at the end of the day, what we want for all of our children is for them to be able to navigate their environment independently and safely. We
Yeah.
want them to be able to, relate to peers in whatever manner that is for them. We want them to be able to keep up with their peers. We want them to be able to navigate their school environment, and we want them to be independent. There is a lot that can go into that to help those children become so successful in whatever those goals are in the moment.
Yeah. Okay. So can we back up for a second? So for those that are listening that maybe don't know, so a physical therapist, what does the education look like? And then also, how is a physical therapist unique from maybe an occupational therapist
Yeah.
or a speech language pathologist?
Such a good question. Okay, so my education, I had 4 years of undergrad that was similar to a pre med route. I had to take biology, chemistry, anatomy and physiology, physics. I had to take all of that in undergrad to then get onto the doctorate graduate program that I went to. So I have a doctorate in physical therapy. It was a 3 year program.
And those
And
are intense programs to get into,
yes,
right?
yes.
Very competitive, similar to like med school.
Yes, it's very competitive, and it was really an intensive 3 years, like, it was full days, and we had 4 different clinical experiences so that we had to go out into the hospital setting, inpatient, outpatient, all these different experiences, but it was a heavy focus on kinesiology, the way the body moves, and a lot of other areas, very, very science-based,
Mhm.
and so that was a 3-year program. As I said, included in that was the clinical experiences. And I was able to work in a school that was like an elective that you were kind of able to choose. And I knew I wanted to go into the pediatric area. And so I was able to land that. After that, you really can go on and get whatever job you want to. If I wanted to go into outpatient, if I wanted to go work with people who've had a stroke or whatever it was, I could then go on and do that. It is a really interesting question of what is the difference between physical and occupational therapy. Speech is a little bit more understandable in that they're really
Yeah.
talking about speech and communication. For OT and PT, it can be a little bit more confusing in terms of what's the differentiation between those two fields. And so I say physical therapy is really about how to physically navigate the environment, where occupational therapy is more about how to get through activities of daily living. So I often compare that a little bit more to like if you take an adult who did have a stroke. In PT, they would be learning how to, go up and down stairs, walk down the hallway, do things like that, right? Where we're actually
Mhm.
moving around, get in and out of bed.
Feed
Physical,
themselves
exactly. Well,
to move their
OT,
upper extremities.
yes, their upper extremity strength, things like that. For OT, it's really about activities of daily living. So that would be learning how to do laundry again or getting things out of cabinets, upper cabinets or lower cabinets, maybe brushing their teeth, things like that that need to be relearned at that later stage. Well, a lot of that can also be seen in the pediatric population, though a little bit more of it is overlapped because a child's occupation is play based, is school based, is a lot of things about navigating their school environment, which
Mhm.
can also overlap with physical therapy as well. When we look at children on the spectrum who need a little bit more support in these areas, there's also a lot of overlap, but an OT might work on playing with blocks, playing with Legos, things that are a little bit more fine motor based, right? Maybe cutting across a paper, coloring, things like that. Where a PT would work on navigating the stairs in their school environment, jumping, climbing, navigating the playground, going up and down the hallways, even being able to get out of the school building when there's a fire drill is something that we would have
Yes.
to work on because that's navigating their environment. The alarm goes off and you need to get out. Well, not everyone can get out at the speed that they need to get out in a safety sort of situation.
Oh my
So,
god, that's
yeah,
such a good example. I never even thought about that
yeah, that was
because
sometimes our
you're
goals.
absolutely right, that's a big one.
It is a big one, right? And are there stairs to get in and out of the building? Um,
And then we're gonna add on possible sound avoidance, right? And
right,
that sensory avoidance. They don't like loud
exactly.
sounds, and then you add on the fear of falling downstairs, the
So that's an
fear
interesting
of all
thing, yes, that you brought up because an OT would maybe work on the sound avoidance, right? Where a
Mhm.
PT would be working on getting down that hallway in X amount of time, right?
Oh,
Or navigating the stairs. So this is
yes.
where you say the goal might actually be both to go through a fire drill in a safe manner, but the actual implementation of that is different in what we're actually working on.
That's so
Right?
good.
Maybe even if we were talking about exploring the playground, the OT might work on taking your coat off the hook, putting it on, zippering, putting on your hat. And PT would work on pushing open a heavy door, walking down the step, climbing up the ladder, going down the slide, right? So it's different parts of the same experience, but we're working on it in a combination. And that's why the team based approach is so important.
Yeah. Another thing that I don't think I brought up yet on this podcast is that both of my girls, as well as myself, we have Ehlers-Danlos syndrome, hypermobile type. And we had to do the whole route with a clinical geneticist, and it was pretty extensive. And so, my kids, when you combine the hypermobility with some of the unique characteristics of autism, the toe walking, the arm flapping, the stimming behaviors, that repetitive movement, and the hyperextension, they've had extensive orthopedic issues over the years.
Yes.
And so physical therapy was huge for her
Yeah.
at a young age to try to work on muscle control. They still need physical therapy even now because I think that parents don't realize the importance of core strength
Yes.
and how that comes into play with every joint, every bone in their body. And so, do you see that a lot with kids with autism where, some of their kind of sensory avoidant or sensory seeking behaviors really starts to impact their joints later on?
Absolutely. And especially you highlighted toe walking, which is a very, very common experience with our children with autism because they are looking for that deep sensory input. And so how does it relate to have sensory input in toe walking? Well, when we're up on our toes, there's a lot more deep pressure through a much smaller surface of our body,
Okay.
right? And so that gives a lot of that proprioceptive feedback of where is my body in space. When you're getting a lot of deep pressure through a small point in your body, it grounds you. Some children and older kids need that more than others. And so a lot of children on the spectrum, they're looking for that deep input. And so they
Okay.
end up high up on their toes. It's one of those things that we definitely want to work on because we don't want to have some of those issues later on where there's contractures, tightness in the calf muscles,
Yes.
impacts on the joints. It can become a challenging thing to work on because they're looking for that deep sensory input. And yet, we don't want the other effects of that to impact them long term.
Yeah,
Right.
absolutely. So we're kind of going back to the Tots on Target. It's a membership program. So what does that look like if I was a mom of a younger child? What would that look like if I was considering signing up for this?
Sure.
What's the value add in my life?
Sure. So the program is called the Tot Spot membership.
Okay.
It's a virtual membership. You can literally join from anywhere in the world, and it gives you access to a few different things. One is my online on demand courses. So for our baby development, it gives courses for rolling, crawling, and walking plus infant massage, which infant massage can be applied through age 7 or 8. And that gives a lot of great, strong proprioceptive input to help with that body awareness through the entire body so that our children aren't only looking through it through their toes necessarily, but they're able to get a lot more deep pressure through their entire body through massage.
Yeah.
So
Yeah.
that's
And a
one thing.
lot of kids that are neurodiverse,
Yes.
they're not just, it's not just toe walking, right? You look at Temple Grandin and the deep pressure and weighted vests and things like this, studies that we show that these kids are craving this.
Craving a
And so
lot of
you
deep
kind
pressure.
of teach them appropriate ways to feed that need
Yeah.
in their
So
child.
right. So that's those are the courses that I have currently. I also have a strengthening through play course as well for our toddlers through I say kindergartners, but it really can go beyond that. In addition, I also have a lot of materials for home-based activities that you can do from your living room, from vacation if you want, and those are activities that work on both fine motor and gross motor skills through play.
Oh,
So everything
awesome.
from building your own obstacle courses to picking up pom poms and putting them in like spice containers to work on fine motor control, all these different things that can help with strengthening the body and building sensory input.
Oh,
So
that's
yes.
awesome.
So all that material is in there as well. Plus, I
That's so
offer
much.
ongoing support. Any parent who have questions, they can post on the news feed that we have there in the community. And I offer feedback right away to help parents along on their journey because where are parents supposed to go to get ongoing support and have somebody that they're going to ask their questions to. You can go to your pediatrician, but at the end of the day, pediatricians are wonderful, but they're not motor development specialists. They're not sensory specialists,
No,
right?
that's not their scope, right? They go to
So,
school for something different.
yes, they're working on, diaper rashes and allergies and
Hand, foot, mouth disease.
exactly the flu and all these other things that they're having to help with on an ongoing basis. But motor development and sensory, that's where they refer out. Even if you have a child who's in school based therapy, I know as a school based therapist myself for so many years, I didn't really have a lot of contact with the parents,
Yeah.
unfortunately. Even when there were parent teacher conferences, I never had conferences with the parents. They never knew what we were working on until the annual review, where I wrote a report and I sent it home. But I rarely had contact with the parent unless the parent specifically requested it. And it was very unusual.
It's important that you bring that up. I kind of
Yeah.
want to touch on something else that people don't really take into consideration very often. Some parents do if they've lived this life and they've experienced struggles, they do. But your school-based PT, OT, speech, that one practitioner maybe has what, like 60 kids on
Probably.
their
Yes.
on their on their course roster, right? And so it is very much so wham bam, thank you ma'am type of therapy where they might be making some progress and it could be the greatest therapist on planet Earth, but the reality is they're still their hands are tied to a degree of how intensive they can get with this kid in that short period of
Right.
time when they have all these other kids on their schedule
Right. And
and
your
they're
and your
driving all
sessions
over the
are
district.
typically a half an hour once or
Yeah,
twice a week.
yeah,
That's typically what the session times are in school, at least where I am in New Jersey. That's typically the way it's done. What is also important to note is that school based therapy, at least in my experience, has been that they're focusing on school based goals, which
yeah,
is a very big distinction than outside of school based goals. When you're working as a school based therapist and the school district is paying for that, we are working on navigating the school environment. It makes sense that a school based therapist is working on what a child has to do in the classroom setting, how to navigate the school building, gym class, the fire drill that I gave that example.
yeah,
All those that maybe they do have an auditory sensitivity and music classes is very difficult for them. So there are things that the therapist is going to work on, but it is very, very school based. So if there are additional challenges that you're experiencing in the home, it's not always it's hard to say the responsibility of, but that really is what it is. It's not the responsibility of the school-based therapist to work on that
yeah,
necessarily, right? A lot of times, I know my OT counterparts, a parent would be concerned that their child isn't brushing their teeth or getting dressed in their own pajamas. Well, they're not going to work on fully dressing in OT in the school-based setting. They don't have the space for that and the privacy for that. It's just not what they're going to do. They're not going to work on teeth brushing because that's not a school based skill. So it is important to recognize that distinction and then find additional resources that are going to help you with the home based challenges that I'm sure are present in most families.
yeah, yeah. And I don't I don't know about New Jersey, but I could tell you here in Florida, it is incredibly hard to find
Yeah.
a pediatric physical therapist. And so you're sitting on these wait lists. It seems like everything with peds is a wait list. So you're sitting on these wait lists. You're like, in the meantime, what am I supposed to be doing? I
Exactly.
wish when my kids were younger, I had known about your program because I would have signed up for it in a heartbeat. Which, on that note, up to what age can people sign up for your membership?
Sure. I do say that it's typically through kindergarten, first
Okay.
grade. That's the higher end of what I support through my program because a lot of those skills that we're working on, fine motor and gross motor through play, my focus has been more the preschool, kindergarten, and lower through babies. So if you're
Yeah.
able to play and manipulate small objects for fine motor dexterity, and squat and stand and be able to go through an obstacle course, other things like that, it is going to support higher level skills that go well beyond that first grade level as well.
Yeah, absolutely. Well, I'll just go ahead and put this out there right now. As soon as we get done recording this podcast, I'm sending all of your information over to my cousin because her and her wife have preemie twins.
Oh!
And I wanna say the girls are about 1.5 now, and oh my gosh, they can so use you, especially since my cousin works for the government and she had just gotten out of the Navy. So, a military family, I could see this being huge for military families because it's really hard to get established with care when you don't know where you're gonna be next year.
That is such a good point. I actually had a family in my membership a while ago. The wife and the child were traveling. Her husband was traveling in a show like Broadway, but traveling all over the world. And they were all over the globe.
Yeah,
And she couldn't get set up with any sort of service because she was never in one place for that long.
yeah.
And her daughter was getting very delayed, was very delayed with crawling. There were some muscle imbalances and she was struggling to pull to stand, and she was able to join and work on it literally from wherever she was, and it was such a helpful tool for her to have.
I can see that 100%, especially if you do have a toddler and let's say you have a job, you're a working mom.
Yes,
And the only time that you can get into that physical therapist for your toddler that's not meeting their milestones is at 11 a.m. every Monday.
exactly.
And you're like, okay, but with my kids when they were younger, when they were doing PT, we ended up stopping PT because the reality is I was having to pull them out of school early twice a week.
Right,
That
and
means I had to take time off. They were missing school. And I was like, this just isn't conducive.
it's so hard. And as you said, a lot of times there are wait lists to
Yeah.
get an evaluation done, and then your child has to qualify. And then it's now 2 to 3 months later before you even start implementing anything, and your child is getting acquainted with the therapist. And then some days they're sick. And so the session is canceled. And then the next week you go on vacation.
Yeah.
It's like this endless thing where all of a sudden 3 or 4 months goes by and you've barely seen the therapist, and there's nothing that's gotten done. Where in my program, it's really about me teaching the parent how to implement very effective, simple strategies that they can do from anywhere in only a few minutes a day. I usually say 10 to 20 minutes a day
I
is
love
what
that.
I recommend. And again, when you think about when I was treating in the school system and you're talking about 30 minutes twice a week, well, a few minutes of that is going to and from the classroom, right? And then
Yeah.
the child has to go to the bathroom or is being changed. And then you go to the session. And then you have to have a play break because they don't really want to do the work. So they have to play with the toy while they're waiting to do the next activity that's actually
Yeah.
purposeful. So there's so much empty time that is not actually useful, where if I can teach a parent how to implement something for 10 to 20 minutes every day or most days of the week, because I'm a parent too and every day of the week is not actually always feasible, but even if it's 4 days a week, whatever it is, you're going to see that progress because your child is most comfortable with you. So when you're setting up something in your own home and stranger danger isn't involved, or getting acclimated isn't involved, or getting in the car and out of the car with the jacket that they didn't want to wear, all those kind of things. You're just in your home and you're taking out something that you can play and it's purposeful. And you're also bonding with your child over a purposeful
Yes.
play activity that's not technology based. And I'm not anti technology, but I know a lot of us parents are looking for ways to get our kids off of screens. And when you can have something that's a very purposeful activity that's going to help your child, and okay, all I need to do is 10 to 15 minutes of this. And then my child can go back to doing whatever they wanted to do. And I know that
Yeah.
I've kind of checked that box for the day. It's very gratifying to know that you're doing something that's helping your child.
It is. It is. I like what you brought up that it's 10 to 15 minutes and you're making it feasible. You're making
Yeah,
it realistic. On the therapy side and on the psych side, we always talk about you can come up with the greatest treatment plan ever known to man, but if your client if it doesn't work for their life, whether that's a medication that you're recommending that it's going to cost them too much out of pocket, or it's therapy that you're recommending that can't work with their work schedule or their life, it doesn't matter. It
correct.
doesn't matter how great the treatment plan is. If they're not going to actually do it, then it doesn't work. And so
It
that's where
has
that
to be
whole
feasible. It has to be
yeah.
feasible. I also very much believe, I think being a parent myself now for 14 years, we need to take the guilt off of parents as well.
Oh,
Right?
100%.
We
The mom
parents,
shame is so
yes,
real.
it is so real in every aspect. And I think especially when you have a child who needs additional support, you already feel like you're trying to grab onto anything that's going to help you out, but it's one more thing that somebody's telling me to do, one more sensory plan that we're going to follow, one more thing that I need to go and buy. It's very
Yes.
overwhelming to feel like everyone's always telling you that there's something else you should be doing and it's never enough. We need to take off that guilt and make sure that whatever you're doing is feasible in your daily life, because you're going to feel better about it as a parent, and it's going to make the biggest impact on your child.
Yeah, it's about meeting the client where they're at. It's not about
100%.
us, it's about the person that we're trying to help.
1,000%. I couldn't agree more with that.
Yeah, and I think that the mom shame that comes into play, and I talk about this a lot, it's normally not other people shaming you. We are our own worst enemies and our own worst critics. It's us shaming ourselves,
Yes.
you
Yes.
know,
You
of, "Oh
feel like
my
there's an
God, I
ideal
forgot to do."
standard.
Yeah, like, "Oh, my ABA therapist gave me this crazy chart that I'm supposed to be filling out every day for my kids, and it's a reward chart, and it's this and it's that," and it's like you're looking at the fridge and you're like, "Oh my God, I haven't filled out that chart in 2 weeks. I'm the worst mom ever. I'm never gonna help my kids. What am I even doing here? Why can't I put a bigger focus on this?" And we shame ourselves, and we
Correct.
go down this spiral, this, negative self-talk.
Right. You have to remember that in the school setting, this is what schools are set up to do. This is the way they structure things, and if the teacher is giving that to you, it is supposed to be supportive, but it's not crazy to think that the school setting and the home setting are completely different environments, and remembering to implement the sticker chart while you're going grocery shopping, while you're trying to make dinner, while
Yeah,
you're folding laundry, while you're getting everyone ready for bed, it's not crazy to think that you can't stop every minute to like focus on the sticker chart. You do the best you can. You make sure that whatever you're taking on is something that you can handle, that's something that is going to work for you, and relieving that guilt. I know that a lot of the parents that I work with virtually, you're 100% right. They self shame and they'll say, "Oh my gosh, don't judge me for using a phone to entice my baby to do this activity." And I always say to them, there is no judgment on my end at all. I
yeah,
have no judgment. You do what you think is best. Do I think that time without phones is great? Of course I do, right? Like
yeah, who doesn't?
we all know that less screen time is better. But
Yeah,
there's no judgment on my end of whether you have to use the phone to get your child to do XYZ. Sometimes that's what we need to do. It's about prioritizing what your goal is, what how you're going to get that implemented, and how you're going to function as a family in your life, and make sure that you're not overstressing yourself, because
yeah.
that does no one good.
Yeah, I think it's important that we learn to celebrate the small wins more and
Yeah.
that we're moving in the right direction. Are you trying?
Yes, I tell
Are
my
you
members that
trying?
a lot, which is when we're looking for successes, we're not looking for long-term successes. And I can use baby development as a better example. If we're working on crawling, I don't say to a parent, "We'll measure the success when your baby starts to crawl." I always tell my members, I say, our success in a few days from now, a week from now, is can your baby push up through their arms for more than 10 seconds, which is what they're doing today? Can they get into a position they couldn't get into before? Are they trying to reach for something when they didn't even try beforehand? Those are the small wins that we're looking for. And crawling is our quote unquote long term goal,
Yeah.
where in a few weeks we're going to see that. But right now, our focus is the short term things, the very small wins that we know that what we're doing is working, it's effective, but we haven't mastered our long term goal yet. And that's okay.
Yeah. Yeah. I love that. Maybe this week I didn't do 5 days worth of the activities that Dr. Allison told me to do, but I did 3 days. And I'm
Correct.
going to celebrate that as a win this week because I made it a priority at least 3 days. It didn't fall off my radar.
Yeah.
And next week, maybe I will do the 4 days. Maybe I'll do the 5 days. But this week, I'm going to celebrate that I did it one day. I'm going to
Yeah.
celebrate that I'm moving in the right direction and I am at least putting in the effort to try. And that deserves celebration.
Yes, it really does. We have to celebrate ourselves a little bit too for the effort we're putting in, because it really does mean something.
Yeah. And from a science standpoint and a behavior standpoint, when you are rewarding your own behaviors with that positive reinforcement of telling yourself, hey, I did a great job this week. I did what Dr. Allison told me to do 4 days this week. My kids ate something other than chicken nuggets at least one day.
Yep.
I did a great, I'm winning at this mom thing or dad thing. And I think that positive affirmation is very much so a positive reinforcer in our behavior that helps us want to continue to make more and more progress. Whereas when we start to incorporate a negative self talk, that becomes a punishment. And so we're going to extinguish any positive behaviors by punishing ourselves with negative self talk.
Yes,
And
exactly.
so then you go deeper and deeper into that hole of, God, last week I only did it 3 times. This week I only did it once. And ugh, I'm so horrible and I'm so awful and blah, 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 blah. Well, you're actually rewarding the behavior in a negative light. And so you're going to eventually make less progress versus if you take the kind of, hey, let's celebrate the small stuff, fake it till we make it. I'm going to say I did a great job at this because I want to add a positive reinforcer to at least I did it for 3 days or
Yeah.
4 days, whatever.
Exactly. Take on
Um,
what you can do to start and build from there and
yeah.
celebrate the small wins. And if every week isn't the same, that's also okay. If during the week it doesn't make sense, then you do it just on the weekends to
Oh,
start, and you build from there.
yes. Can we duplicate you, please? Can we just like clone you and put you in every state in the country? You are actually with your online program. There we go.
I'm very fortunate, but yes, and you know what? That's years and years of working with children and parenting. Because before I became a parent, when I was a therapist, I don't want to say I was judgmental of parents, but it's very easy from the outside before you become a parent to think to yourself, well, why can't the parent do more? Why did this kid show up in a nightgown? Why don't they have more boundaries at home? Right?
Yeah.
It's very easy to think that when you don't realize what goes into a morning of getting your child out the door, who
Yeah.
struggles with sensory, who struggles with motor planning, who struggles with just getting up in the morning, right? Maybe they don't sleep well at night and you're all exhausted and you just can't get out the door, or you just had a bad morning. It was just an off day. Once you become a parent and you realize, wow, this is way harder than I ever imagined, and what those mornings can look like can be actually crazy. It gives you a
Yeah.
new light of, you know what, you have to just do what you can do. Just worry about how you are coming into the situation and feeling good about giving your kids the best you can in the moment. And that is going to look different every day.
It is. It is. And it's going to look different for every kid.
Yep.
And I think when you try to, you shift your focus and you manage your expectations and you look at it from a perspective of, okay, I've spent X number of months or years, depending on where you're at on that parenting journey, putting in band aids and putting out fires. When if I had taken a little bit of extra time to get the physical therapist, to follow what they were telling me to follow, it prevents me from putting out fires in the future. And now we're working more towards long term goals. We're being proactive versus continuing on a pattern of just being reactive of crap, I didn't get the physical therapy. And now my kid has to see an orthopedic specialist. When if I had done that, and avoiding the mom shame at the same time. And instead of saying, I should have done this, saying, okay, well, that didn't happen. It is what it is. That it didn't happen for a reason. I'm sure there was a good reason why it didn't happen at that time. So, how can I fix this moving forward? What can I do today that's different than yesterday? Let me call the physical therapist. Let me sign up for this membership so that I'm not perpetuating this cycle of being reactive. Today's the day that I'm going to be proactive. I'm going to get online so that life can be easier in the future.
In addition, I want to say holds you accountable, but I don't actually mean it in that way. I mean that when you do have an off day or you're having an off week or everyone got sick and you're getting back in, sometimes it's hard to like motivate yourself to get back in the groove, to get back into the systems that you had in place before. You went
Yes,
on
the
vacation and
routine.
right? And you're like, okay, how do I like start again? And it can feel exhausting. And when you have that additional support for yourself, it helps you stay consistent or get back on track in those moments where you feel like you need to pick me up. You know what I
Yeah.
mean?
Yeah, absolutely. They talk about this with like weight loss groups. That's why
Yeah.
Jenny Craig and all that stuff was so successful, or maybe is, I don't know. But it's because it comes with that community, that sense of
Exactly.
community, and you're holding each other accountable and you're there to pick each other up when you fall.
Right. because on for any parent, even with the easiest kids, which I don't have those, but I don't know who has
There's
the
no
easiest
such
kids.
thing.
There's no such thing. But if you look at somebody else and you say, oh, they have such easy kids, even for that family, there are hard days, there are hard moments, there are tantrums, there's things that those children avoid and don't like and struggle with. And we all need something to help us go through the motions, pick ourselves back up, get back on track, and, and continue the journey.
Yeah, yeah, and stop the shaming, the self-shame.
Yes.
Yep. My first child gave me the confidence to be a mom. My second child taught me not to judge other parents.
Yes.
Yeah,
As I said, before I became a parent and I looked at other situations and now I'm like, no, it's hard, it's challenging, and every kid comes with their own set of needs.
yeah. And none of these kids come with a instruction manual of, "Hey, here's how you parent Riley today."
Correct.
Yeah, no. Yeah, a lot of those
Don't
instruction
you
manuals.
wish? Maybe that'll be
Yeah,
some business that comes out, right? Manuals for all children, and
yeah,
it's
wouldn't that be
never going to
great?
exist because it's just not possible.
Yeah, it'd be infinity. Yeah,
Yes.
it's not something we can even comprehend. You just take
No.
it day by day and just as long as we're moving in the right direction. I tell parents, your child clearly feels your love and knows that they're loved. They know that they are worthy of love. They are fed, they are clothed, even if they're in the princess costume today. Hey, guess what? They're clothed,
Yep.
right? They have protection on their skin from the elements. They have a roof over their head. That, when everything is said and done, that's the big stuff. That's the stuff that matters. Do they feel love? Do they know that they're accepted? That's what matters.
Correct. Because the things that we judge ourselves on are not what our kids are judging us on.
Exactly. Yes, exactly. Keeping on this track with vulnerability and being a mom, what is something that you feel like you've struggled with, whether it's in your career as a business owner, whether it's as a mom? What's something kind of personal to you that you've struggled with, and how did you overcome that?
That's a great question. So I think I'm going to share in the business end that I've struggled in, or I've kind of worked through to help parents who struggle with this is a lot of the mixed information that is out there. A lot of the resources out there have come out that early developmental milestones aren't super important anymore. That it's just about getting around. It's very hard and very challenging to then come with a different perspective and feel like I am kind of shocking that world a little bit.
Yeah.
But it is something that is a struggle on our end where it's almost like I need to educate the market of no what PTs and OTs and speech therapists when we come to the table and say no, developmental milestones are important, sensory is important, we need to pay attention to these things. And there's a message on the more medical side where a lot of parents are going to their pediatricians, they'll hear, don't worry about it, it's not a big deal, wait and see. And
Oh,
it's a big problem. I mean, I'm not going to single-handedly resolve this, but I do think it's a very, very hard challenge for parents to feel like there's such mixed messaging out there because they'll go to their pediatrician. I hear this constantly from my members of they're told to wait and see, wait and see, wait and see. And at what point are you not waiting and seeing anymore? And then there's me. I'm not a fanatic of every time you see like a slight delay, go and run for an evaluation. I don't believe that either. I think that there's windows in which children are going to meet developmental milestones, but we have to pay
yes.
attention to those milestones because if they are delayed, early intervention is a thing for a reason. The earlier we get in there and help and support, the more effective we're going to be at earlier stages. Doesn't mean we can't help older, but it is going to be easier the earlier we start. And
Yeah.
so I do find that it's very hard to feel like I'm going up against the medical community, which I'm a part of, but also giving parents that information of like, if you and your gut feel like there's a problem, you don't have to just wait and see. You
Yes.
have to be able to feel comfortable being an advocate for your child, which is exhausting and hard and challenging. I want to empower parents to know that you have to be able to ask the right questions. You have to feel confident that at the end of the day, you know your child's best. And if you do see delays, if there are things that you're worried about, you have every right to go and find answers to your questions.
Yes. The CDC has a campaign primarily related to autism, but it applies to milestones in a general sense. And their campaign is Learn the Signs, Act Early. And it says right on their campaign, if your pediatrician told you to take a wait and see approach, seek a second opinion. For the CDC to flat out recommend a family seek a second opinion from their pediatrician. Medical lobbyists are some of the strongest lobbyists in our country for medical doctors. And that's brazen for them
Yeah.
to do that and to kind of go against possibly medical lobbyists or the medical community, or maybe, let's just speak honest here, piss off the medical community.
Yeah.
That's a big deal. So the fact that they did that and they created that campaign and they have the CDC milestone tracker app and they're saying, no, 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 do not take a wait and see approach if your child is delayed on milestones, get early intervention immediately. That means that it's a big enough problem that they were willing to take the risk of pissing off the medical community and
Yeah.
medical lobbyists. And so that right there supports everything that you just said.
Yeah. It is interesting because the CDC, a few years ago, they changed their milestone list
Okay.
where they had taken off a few milestones. Now, from what I understand, they changed it so that it was what milestones most children were meeting. And I don't fully understand it, to be honest, and I have to dive a little bit deeper. But the trickle down effect has been challenging in that the medical community is now using that as kind of like the standard, where it's not the standard of what the milestones that children need to be reaching are. Right? It's
Really
kind of used
interesting.
as like all children should be meeting these milestones, but it's not a full comprehensive list. The forms and the testing that PTs will do is much more extensive. It has a lot more milestones. It has a lot more mini milestones in there than just the big ones. And so we want to make sure that we're staying on top of all the milestones, making sure that babies are rolling in all directions, crawling, pulling to stand, and really going with that more comprehensive list and making sure that we're on track with that development, which is so important.
That's so interesting. I had no idea.
Yeah.
See,
It's so
I'm not a physical
interesting.
therapist, right? So I wouldn't
Yeah,
know that unless
yeah,
someone like you is bringing this to my attention.
yeah. It is a very interesting thing, and I don't think it was meant to have that trickle down effect, but it seems to have been that pediatricians are then saying crawling, for example, was eliminated from that list. And now pediatricians are telling parents like, "Well, if your baby doesn't crawl, don't worry about it." And the challenge there is crawling is actually a very big part of bilateral coordination, using both sides of the body together. There's a lot of deep sensory input that's applied through crawling on all fours. There's a lot of hand strengthening and shoulder strengthening that it's needed for fine motor skills and play skills needed later on. So it's very interesting and something that I do want the CDC to relook at because I don't think it was meant to have that effect, but it
It
has.
did.
And
Yeah.
yeah. Yeah,
It's
which is
just
interesting.
one more thing that's kind of off the radar
Yeah,
of, "Nah, we don't need to look at this." The CDC is
right,
saying we don't have to look at this.
right, right,
Yeah.
which I don't think that was meant to be that way, but, that's what parents are coming away with
Yeah.
from all checkups.
So do you have a milestone tracker?
Yes, yes, I do. So on my website, I have a free baby milestone checklist. I think it goes through 18 months that is available for free to download on totsontarget.com.
Oh, that's awesome. I
Yeah.
love free stuff. We all love
Which
free
is much
stuff.
more comprehensive. It's not to necessarily make parents worried. I don't believe that every baby and toddler meets every milestone at exactly the same time. That's not
Yeah.
possible. But we want to make sure that our children are on track with development in the typical age ranges so that if they are falling behind, we are on the lookout and we can give them the support that they need.
Yeah, absolutely. Oh, good stuff. Okay, so my last question is if you could give one or two pieces of advice to your younger self, what would it be?
Wow. What would I give to my younger self? I think I'm actually going to go with the parent version of this, right? Because I talked about the
Okay.
professional, but I think I'm going to actually talk to my younger parent self and tell myself to not over focus on the small things. especially when the first time around for me. I think that there's a lot of talk, and this is where a lot of the mom guilt, the parent guilt comes in, where first time around, I felt like if I don't set these strict boundaries, if I'm not implementing certain things, and I don't have a strict bedtime and I don't have a strict something, that it's all going to fall apart,
Yeah.
right? And
And
it's
I'm going to
just,
ruin my kids.
yes, and I'm going to ruin my kids. And then other people are going to judge me that my kid misbehaved because I didn't have this strict boundary and I didn't put them in a timeout for this, or I didn't talk in a certain tone, or I don't know, whatever. We can go down the rabbit hole of all the things that we negatively self-talk, as you said.
Yeah.
And I would really want to look back at myself and say, do the best you can. Some moments you're going to have parenting wins. You can't possibly have every moment being a parenting win. You're not going to get discipline right all the time. You're not going to reward constantly in the right way. Sometimes you're going to mess it up or not do it the perfect way that the books tell you to, or the Instagram channels tell you to, or now TikTok tells you to. It's looking at the big picture of trying to do the best you can. And I think you said it best, make sure that your kids feel loved, and not to the point that you're overindulging. I don't believe in
Yeah.
that either, but trying to find the balance where you're giving your kids love first, and in the moment when they are having a tantrum or there's a bad moment, don't use those moments to judge yourself as a parent, because we all have them. We all have tough moments. We've got to get through them. And when I look back on those moments and I think about a few that I'm like, "Ah, did I really need to be so strict in that moment? Did I have to feel like I wasn't doing the best, that I caused this situation to happen?" Relax, take a breather. Not every moment is going to be perfect, and that's okay.
Yes. Oh, really good advice. Really, really good advice. Cut yourself some slack.
Cut yourself some slack, right? To sum it up, right? Cut yourself some slack. It's
Yeah.
gonna be okay. And boundaries are important. We don't want kids who just run around, and have no boundaries and no whatever. But if you love your kids, and you have to be able to say no, obviously. But sometimes you can also say yes, and it's okay. And
Yeah.
they're not gonna everything's not gonna go crazy just because you let loose a little bit. It's okay.
Yep. Yep. Absolutely. Do a yes day. That's what I do
Yeah,
for my girls
yeah.
once in a blue moon, with very strict boundaries on our
Exactly.
yes day. We have
You have to know
very
what
strict
your
boundaries.
boundaries are. Like, we don't cross this. You
Yes.
have to know what those are, be true to those. Relax when your 2-year-old is having a tantrum, and that's the time you use to try to set the strong boundary. You're probably not going to win them over in those moments.
Yeah.
It's
Yeah.
not going to happen. And so ride out the tantrum, and you'll implement the teaching moment after the fact.
Yes. Great advice. Okay, so tell people how they can get a hold of you, how they can sign up for your membership.
Sure.
Like I said,
So
I'm sending this to everyone I know
yeah. Oh,
immediately.
thank you so much. So my website is totsontarget.com. Very simple.
So
And that is my handle on all channels. Tots on Target on Instagram, TikTok, YouTube. I think I'm on Pinterest too now. And that is a great way to get in touch, to sign up through the membership. Info at Tots on Target is my email address. I really just want to support parents wherever they are, so that they feel good about their parenting journey, and they feel like they have somebody that they can ask their questions to, get the next steps going wherever that is, and whatever the next stage is.
oh, I love it. Well, Dr. Allison, thank you so much for coming on today and sharing all this information. For those that are listening, if your kid is an MPT, hopefully at the end of this, they understand the value that physical
Absolutely.
therapy and milestones and things like that can have on their child's life and their life. So
100%.
thank you. Thank you
Thank you
so
so much.
much.
Thank you for having me. Really appreciated being with you.
And thank you so much for listening, for tuning in. I really appreciate the comments. Like I said before, drop us a line. And I hope that you realized after this podcast episode that if your child is not getting physical therapy, they probably could benefit from it. Thank you. Again, go out and conquer your day.